Go.
Hi, welcome, and it's great to be here and see all of you. I'm Selena Byrd, the principal of Starfish-led Marygrove Early Education Center. It's been a minute since we've seen one another, so I just want to say hi, and we have something great in store for you today. So as you know, here at the Marygrove Early Education Center, we serve the littlest learners under the age of 5 years and their families in the Livernois, West McNichols community of Detroit. This is our live Byrd Tweetz. You know, we do this bi-monthly, and we share all of the amazing happenings that's happening here on campus or at the Marygrove Early Education Center. So today we're sitting in the central courtyard of the Marygrove Early Education Center. You'll see lots of glass. It's just a beautiful space. And we thought it would be great to spend some time with you here. The sun is out, it's gorgeous outside. And like I was saying, today we have something special planned just for you. So I want to talk to you about, or introduce you to, the special guest we have here for National Nurses Day. So we have, we want to welcome Laura. We affectionately call her Nurse Laura, and she's like our stellar on-site person here at the EEC. And then we also want to recognize, because it's National Nurses Week, Shy Johnson, who's our manager of Starfish's Nurse Family Partnership Program. Okay, so let's start with Laura first. So Laura, we have a few questions for you. You know, I just adore you, and I'm just so happy you're able to join us. Why did you decide to become a nurse? Like, what inspired you?
Thanks, Selena. It's great to be with you. So I will say I've wanted to be a nurse from the time I was tiny, probably as little as our little ones here at Marygrove at the EEC. There are pictures of me in kindergarten wearing a nurse's costume for Halloween. And my first book report was on Florence Nightingale. My mom's a nurse. My grandmother was a nurse, and my aunt is a nurse. So I just grew up around nurses and teachers and knew that that was part of who I was.
Oh, wow. That's, I can see it. I can see that. So why do you particularly enjoy working in a school setting? So want to thank University of Michigan for their partnership and, introducing us to Nurse Laura and having her on site as our nurse navigator. But what excites you about working in a school setting?
So I worked, the first 10 years of my career was in a pediatric hospital, mostly in the intensive care unit, so about 9 years working in pediatric intensive care. And one of the lessons that I learned in that space is that most of our health decisions and healthcare happens outside of the hospital. So I love being able to work with families and talk to families about decisions about real life health choices and really helping them be their healthiest selves in settings outside of the hospital, because I think that that's where most of these choices and decisions live.
Oh, wow. Thank you so much. So I know one of the things we like to do here, we have here at Marygrove, is what we call the Healthy Family Center. And Nurse Laura is part of this Healthy Families team. So when you think about the partnership and the opportunity that you had to work at Marygrove Early Education Center, what was that certain something that made you say, yes, I'm willing to do this. I want to be a part of this?
So I'm a family nurse practitioner by training, and I've been working as a family nurse practitioner for about 10 years. And again, going back to my pediatric roots, one of the most important parts of taking care of kids is really working with the entire family, because no child is able to make all the decisions about themselves on their own, right? It's really about helping support families. And so being a part of the program at Marygrove helps me kind of be aware of what's happening in children's lives, in their families' lives, and really support them to be their healthiest selves and make good choices and empower them to really take control of what's happening with their own health.
Okay, thank you. And if I recall, one of the things we talked about, one of the reasons we wanted to have a nurse navigator was to help families navigate the healthcare system. So we've been in this pandemic, and you've not had the opportunity to really have like in-person touch points with families. But when you think about your scope of work and what you've been able to accomplish thus far, and I have to say you've been rocking it out for sure. Can you talk to us a little bit about that when you think about your scope of work?
Yeah, so one of the things that's been really exciting is being able to answer families' questions about what's going on with their child, or give them some additional information about different healthcare issues that have come up, helping them feel, one, like they understand the information that they're being provided by healthcare providers. Sometimes those appointments are so short, and complex information is relayed, and I feel like, more and more, we don't want to spend time in our healthcare providers' offices just because of all the risk of exposure to other illnesses and viruses and things. So sometimes it feels like those already short appointments are even more rushed. And I think being here has given me the opportunity to kind of be available to families, answer questions. I've had some really nice interactions with folks sending me emails with questions. Some of those are coming up in the Ask Nurse Laura emails. And some of those are just back and forth, and I encourage families to continue to send their questions, concerns. I'm happy to interact with them and share information, and learn what they know and what questions they have about what's going on.
Thank you, and thank you for mentioning the emails that you receive. I would like to mention to everyone that we have an Ask Nurse Laura column, if you will, with our weekly communication that goes out to families every week. So Nurse Laura has jumped right in. She gives answers. She's always available, and we appreciate that. And so we're hoping some of our families will take advantage of visiting, sending more questions, or coming to see Nurse Laura Mondays and Wednesdays. I think your hours again, Monday mornings, 9.
Usually about 8 a.m. I try to get in by around 8 a.m. and I'm there till about 1. And then Wednesday afternoons, I'm typically there from about noon until around 5:30 or so.
Okay, thank you. Thank you so much, Nurse Laura. Appreciate your talking with us. So now, bye.
Bye.
See you later. Thank you. So now, see, we're savvy here. We're figuring this out, right? So now I have the pleasure of talking with Shy, who's, again, with Starfish Family Services, and she's our integrated health care manager. We have so we're used to the abbreviation, so this makes me have to say it. Okay, so we're going to talk a little bit about the Nurse Family Partnership. So it's a powerful program that Starfish Family Services has the pleasure of implementing and being a part of. Can you tell us and tell the families, how does it work?
So first I'd like to say that Nurse Family Partnership is an evidence-based home visiting program for first-time pregnant moms up to 28 weeks pregnant. And it supports low-income moms, low-income families who may meet the guidelines for low income, but that does not necessarily mean they have to be on Medicaid or that they have to be on WIC, but they should be eligible for those things.
Okay, so eligible. And you said this is a national partnership?
It's a national partnership. Nurse Family Partnership is all over America. We were I believe we're the only agency that's like an all-inclusive agency that has a Head Start, behavioral health services, as well as home visiting at its core, that has a Nurse Family Partnership program, though.
Oh my goodness, that's Starfish Family Services for you, I tell you.
Definitely.
Okay. So I think you were telling me that if a parent or someone is part of Nurse Family Partnership, it's kind of like they have their own personal nurse. Can you tell me about that, please?
It's one of the best things, you know. Having your own personal nurse may seem like out of your reach, but it is not. It is definitely within your reach. It is for, like I said, the families of first-time pregnant moms up to 28 weeks. I keep saying that because it's such a good program. We know that everybody wants to participate, but this home visiting service is for first-time moms up to 28 weeks pregnant. And I got so excited about what I was getting ready to say. Say the last part of your question again.
Oh, I said, well, you know, it's a personal nurse.
Yes,
Tell me
so
about that.
the
Okay.
personal nurse. The best part about having the personal nurse is that the personal nurse can be the person that can be an advocate in the home, right there with the family. So while the nurse is in the home, the parents and the families just feel comfortable sharing their thoughts and their feelings. And as Nurse Laura said, sometimes when moms are in the OBGYN clinics or various places, they may not feel so comfortable, especially first-time moms, asking the questions to the doctors, or they may feel rushed. When you have your own personal nurse come into your home, she's present with you, she's there, and you can moms can ask the questions that they have, discuss the fears that they have. And our nurse family, our nurse home visitors, they spend the time with the families, not just doing general things, but like say mom has a health need or a mental health need, or she needs resources. Our nurses spend the time with the families to help them connect to the resources that they personally need. And that is one of the best parts about the personal care. And there's so much more, but that is in a nutshell it.
So there are a lot of benefits, if you will. So it sounds like a lot of strong relationships and partnering with the families. I
For
love it.
instance, we're a part of Starfish, right? So then that connects our moms with Early Head Start. That connects our moms with infant mental health services. So there's so many ways that Starfish is supporting the families, but we're like the warm handoff to a lot of other programs as well.
The warm handoff. You know, I just get warm and fuzzy about that. I just believe in that all day. So talk about some of the responses. So we know parents I'm sure they have good things to say. I mean, how are they feeling? What is the feedback? What have you heard from parents?
So one of the best things about our Nurse Family Partnership Program is that we have a community action board. And our community action board actually has parent involvement. So we're able to get real-time feedback on where we're going and the thoughts that we have. And one of the clearest things that we hear from our families is that they're glad that they have a voice and that they're able to use their voice for their family and investment. They love the way that Starfish is investing in the community. They also really, really, really appreciate being able to be connected to other resources and supports as well. So we're hearing that a lot, and it's the personal care too, that personal touch with the home visiting that's important to them.
That's powerful. So you said eligibility, low income, up to 28 weeks. Is there anything else we should know about that? Is this available to anyone in Wayne County, or could you talk a little bit more about that?
Yes,
Thank
this
you.
program is eligible for any first-time mom in Wayne County up to 28 weeks pregnant. And one of the integral parts of this, yes, we said up to 28 weeks you can be a part of the program. However, we stay with you up to 2 years, and that's important. So you're not just abruptly ending the relationship. And also, because we're a part of Starfish, there's another way for us to extend your family connection, because we then, as I mentioned before, there's those warm handoffs to other programs that can be beneficial. So you're not just losing your sense of community when our program ends. And I just think that is very important.
It is. Thank you so much. So I need you to tell the audience, I want to know more about this program. What number do I call? What do I do?
Okay. So the number to call is 1-833-NFP-BABY. I am going to tell you the actual numbers, and I need to look down. 1-833-637-2229. And we also have our own website as a part of Starfish, and it's starfishnfp.com. So there's more than one way to connect with us, and we are looking forward to hearing from you.
Oh, I love it. I love it. So, everyone, there's a couple of more things that we want to share with you, right? So,
Yes.
first of all, we want to thank you for joining us, but we also want to send out a couple of shout outs.
Yes.
So, how about you go first and then I'll send out.
So, as you heard earlier, that this is a Nurse Appreciation Week, May 6th to May 12th. May 12th is actually Florence Nightingale's birthday, and so that is why we have this every week. And we want to give a shout out to all the nurses everywhere, just letting you know that we love you and you are so important to us, and we really know that without you we are not able to make it in this society. Nurses hold the society together.
Oh, I like that.
Yes.
Okay, so I am going to add to that that last week was National Teachers Appreciation
Woo!
Week.
Yes.
And we celebrated our teachers across the Starfish Family Services platform. And guess what? Teachers. What do the teachers do?
They are an integral part for
Yes.
all of society.
Yes, they are. And teachers hold everything together. I want to thank all of the teachers for all
Yes.
of the hard work, your dedication. I know you're tired and exhausted sometimes, maybe more times than sometimes, but we really, really appreciate you and love you and praise your commitment and dedication to our littlest people. I thank you so much. So in the meantime, thank you, Shy.
You're welcome.
I want to tell you, if you want to learn more about Starfish Family Services, Marygrove Early Education Center, please visit our website, starfishfamilyservices.org. You know we have year-round enrollment. We do have a wait list. However, we're checking that every month to see, through our selection process, to fill the vacancies. We'd love to have you join our family. Thank you so much and have a great day.
Woohoo. Bye-bye.
Bye.